This segment of Montana Matters is sponsored by Rimrock.
Welcome to Montana Matters. Back on the show today, we have Rimrock. We're joined today by Christy Beals. She is the Chief Nursing Officer, and we're talking today about alcohol, the forgotten addiction. So welcome, Christy.
Thank you.
Yeah, so how common is alcohol addiction treatment at Rimrock?
I think what might surprise people is that alcohol is actually our #1 drug of choice.
Wow.
And so in the age range that we serve clients, 18 and above in detox and inpatient, alcohol continues to be our #1 drug of choice. And it's forgotten because it's not seen in the news as much as some of the other drugs. And people are surprised when we tell them that. So.
Right, but a lot of people seeking treatment for that. What about the physical complications? What happens?
Yeah, so alcohol is really hard on your body, especially at high doses and high frequency. And so what people don't understand sometimes is that alcohol can be really hard to withdraw from. So for our patients who suffer from alcohol use disorder, they're at really high risk for complications if they choose to stop using alcohol. And so what we tell patients and their family members is that if they have a loved one who they're concerned about, that it's best to get them medical detox or take them to a local facility, a healthcare facility in their communities. There's signs of high blood pressure, high heart rate. If they're coming off of it, there's high risk for having seizure activity. Sometimes they're having hallucinations and sometimes even delusions. And so there's a lot of health factors that are associated with chronic alcohol use disorder.
Wow, and a lot of serious complications can happen.
Yeah,
And
very serious.
We were mentioning, we were just chatting a little bit before the show, there's interval drinking too when people get to that point. So they're drinking throughout the day, right?
Yeah, so I think sometimes people are like, well, what's the difference between binge drinking and alcoholism or alcohol use disorder? And there is a difference. Alcohol use disorder is really when the brain takes over and says, I can't live without this drug in the body. And so after somebody starts to consume alcohol at a certain level, they actually have to start using it throughout the day sometimes. Wow. And more and more and more, because they start to have some of those symptoms like the tremors, like the sweats. They're not feeling well, they're nauseous. And so what we see is that disorder tends to grow upon itself, and they start drinking throughout the day because they start getting those physical feelings and those interactions that are happening, and that's where the disease just progresses. And we always say you can have a high functioning alcoholic until they can't function anymore. And that's because the disease progresses. That's the substance use disorder.
And that's a lot different than the binge drinking.
Very different. And the physical impact on the body is different.
Very. Okay. So what treatment options do you have at Rimrock?
Yeah, well, it starts with the highest level of care, which would be our medical detox facility. The average length of stay is 3 days, and so to help work through those symptoms, we have medications and we have trained clinical staff that help the patients through that. After that, we have inpatient treatment, which is normally a month program, 28-day program, and then from there we have all levels of care. We have day treatment where they can start getting back into their normal lives, they can start getting back into the workforce and their communities and into their home lives. And then we have intensive outpatient, which is the same thing, and we continue to work with the patients but also working with their families.
Okay, that's great. And why should someone choose Rimrock?
Rimrock really is just, we have trained staff. We have a lot of staff in recovery, so they've walked the walk, and they're compassionate, loving people who want to help see people have a life filled with joy.
All right. Thanks for all the great information, Christy. And if you'd like more information, get a hold of Rimrock. Give them a phone call or visit the website.